Good day, everyone. Today we will be discussing hand hygiene practices, one of the simplest yet most effective methods in infection prevention and control. Let's get started. These are our objectives for today. The focus is to ensure that by the end of this lecture, you will confidently practice the correct techniques and understand when and how to perform hand hygiene in different clinical scenarios. Hand hygiene remains the simplest, most cost-effective method for preventing healthcare-associated infections. Today's guidelines are based on the World Health Organization's recommendations, promoting safer care for everyone. The WHO defines 5 moments during patient care where hand hygiene is crucial to interrupt germ transmission. These moments are designed to cover all possible points where contamination can occur. Understanding and adhering to these 5 moments helps build a strong infection prevention culture in healthcare environments. Moment 1, before touching a patient. Always clean your hands before touching a patient to avoid transferring harmful germs that you might be carrying. Moment 2, before clean/aseptic procedure. Before you perform a clean or aseptic procedure, such as inserting a catheter or setting up in 4-line, hand hygiene is essential. Moment 3, after body fluid exposure risk. After any risk of exposure to blood, secretions, or other body fluids, hand hygiene must be performed. Moment 4, after touching a patient. After you finish interacting with the patient, even if you think your hands are clean, it's vital to perform hand hygiene before moving on. Moment 5, after touching patient surroundings. Microorganisms can survive on surfaces for hours. Always perform hand hygiene after touching items in the patient's immediate surroundings. Wearing gloves is not a substitute for hand hygiene. You must clean your hands both before putting on and after removing gloves to prevent cross-contamination. Gloves should be changed between patients and also when moving from a contaminated body site to a clean site on the same patient. Remember, gloves are a complement to, not a replacement for, proper hand hygiene. Soap and water are necessary when hands are visibly dirty, after using the toilet, or when dealing with pathogens like Clostridium difficile. Alcohol-based hand rubs are not effective against certain spores. Remember to scrub your hands for at least 40 to 60 seconds during hand washing to achieve maximum removal of microorganisms. Remove jewelries and wet hands with water. Apply enough soap to cover all hand surfaces. Rub hands palm to palm. Right palm over left dorsum with interlaced fingers and vice versa. Palm to palm with fingers interlaced. Backs of fingers to opposing palms with fingers interlocked. Rotational rubbing of left thumb clasped in right palm and vice versa. Rotational rubbing, backwards and forwards with clasped fingers of the right hand in the left palm and vice versa. Rinse hands with water. Dry hands thoroughly with a single-use towel. Use a towel to turn off the faucet. Proper hand drying is critical because microorganisms transfer more easily from wet skin. Always use a single-use towel or allow hands to air dry naturally. Never wipe on clothing or shared cloths. Neglecting this step can undo the benefits of proper hand washing. ABHR is recommended when hands are not visibly soiled because it kills most microorganisms quickly and efficiently. It only takes 20 to 30 seconds for hand rubbing with ABHR to be effective. Make sure to cover all surfaces of your hands and allow it to dry naturally without wiping. To perform hand rubbing, apply a pumpful of the product in a cupped hand, covering all surfaces. Rub hands palm to palm. Right palm over left dorsum with interlaced fingers and vice versa. Palm to palm with fingers interlaced. Backs of fingers to opposing palms with fingers interlocked. Rotational rubbing of left thumb clasped in right palm and vice versa. Rotational rubbing, backwards and forwards with clasped fingers of the right hand in the left palm and vice versa. Once dry, your hands are safe. Damaged skin is a risk for infections. Ensure your hands and forearms are free from open lesions before providing care. Small breaks or lesions can be entry points for harmful bacteria and viruses. Protecting your skin also protects your patients. Long nails and jewelry harbor microorganisms and interfere with hand hygiene. Keep nails short and avoid jewelry in clinical areas, especially rings, as they increase the surface area for germs to hide. Even clean-looking hands can carry pathogens under rings and artificial nails. Let's look at how the 5 moments for hand hygiene apply in specific clinical scenarios. Each type of care, whether it involves catheters, tubes, or dialysis lines, has its own critical points where hand hygiene is essential. Adapting the 5 moments to these situations ensures we break the chain of infection and protect both the patient and healthcare environment. Always perform hand hygiene before and after manipulating urinary catheters to prevent urinary tract infections. This includes before insertion, when collecting samples, or emptying the drainage bag. Proper catheter care reduces the risk of catheter-associated urinary tract infections, CAUTIs, one of the most common healthcare-associated infections. For patients with endotracheal tubes, strict hand hygiene before and after airway care is key to preventing ventilator-associated pneumonia. Before suctioning or performing oral care, perform hand hygiene to avoid introducing bacteria into the respiratory tract. After handling secretions or adjusting the tube, clean your hands again to avoid spreading pathogens. Remember, a consistent ventilator care bundle and strict hand hygiene work together to improve patient outcomes. Central lines have a high infection risk. Perform hand hygiene before and after each manipulation to prevent bloodstream infections. Ensure full sterile technique at the time of catheter insertion and use antiseptic solutions properly. Although peripheral lines are common, they can still cause serious infections if not properly cared for. Perform hand hygiene before and after handling the catheter, drawing blood, or changing dressings. Aseptic non-touch technique helps minimize the risk of introducing skin flora into the bloodstream. During hemodialysis, hand hygiene is essential because the vascular access site offers a direct route into the bloodstream. Always clean your hands before connecting and after disconnecting the dialysis lines. Infections related to vascular access are a leading cause of morbidity in dialysis patients. Hand hygiene compliance in this setting can drastically lower the risk of bloodstream infections and improve patient survival. Hand hygiene is our first line of defense. Mastering these techniques will protect both patients and healthcare providers. Always apply the 5 moments in every patient interaction and adapt them according to the clinical setting. Small, consistent actions like hand hygiene can have a massive impact on infection rates and patient outcomes. Thank you for your attention. To complete this session, kindly answer the post-lecture quiz by scanning the QR code or accessing the link provided. This helps ensure proper understanding and consistent practice across all shifts.